Hi, everybody. Welcome to Missouri Rural Crisis Center's second Ask Me Anything on Medicaid. Today is going to be about Medicaid budget and expansion. You guys had a lot of great questions about that last time, so we wanted to give it the space it deserved and bring in the experts on that. I want to real quick just say thanks to my colleague Jamie Blair. She's running the behind the scenes wizardry that makes us all look much smarter and more coordinated than we are. So we're grateful for that. If you are new to MRCC, I encourage you to like and follow our page. That will be a wonderful way to keep up with when we do events like this, and also check out our partners here, St. Louis University and Missouri Budget Project. I want to go ahead and quickly introduce our experts, and then we'll get down to answering some of my questions, and we'll make time for yours as well. So if you have questions, go ahead and write those into the chat whenever they come to you. First, I want to introduce Sidney Watson here. She is the director of the Center of Health Law Studies at St. Louis University. She is a specialist in health law and healthcare access for the poor. She spent her entire legal career advocating for low-income people, whether that was as a legal services lawyer or now training the next generation as a professor, which we're really grateful of. And she's basically an expert in all things Affordable Care Act, Medicaid, and healthcare access. So I look forward to you trying to stump her. She literally wrote a book, maybe not the book, but a book on Medicaid in Missouri. So, and Amy Blouin is the founder and CEO of Missouri Budget Project. If you are not familiar, you should be. Missouri Budget Project works to improve the quality of life for all Missourians by informing public policy decisions through objective research and analysis of all of the things that are difficult for us to understand. State budget, health, tax, and economic issues. We're really grateful that they help break that down and make it understandable for the rest of us because it's so important. It's at the heart of all we're doing. And then both of these wonderful women have been really hugely influential in the ballot initiative process that you're going to see on August 4th here in Missouri, as well as fighting for Medicaid expansion for, what is it, 6 years, 8 years? 1,000 years. Wonderful allies. So go ahead and type your questions if you think of them. I want to start off by giving the floor to Amy here to kind of lay some groundwork for us on Medicaid and the budget, just how this is all working.
That's great. Thanks, Dina. I am really happy to be with all of you today. You're going to have some slides in front of you, and I'm going to be rattling off a bunch of numbers. So really feel free to interject questions and stop me if something doesn't make sense, and we can help clarify stuff. So what you're seeing right now is basically just how Medicaid is funded in Missouri. And the reason why this is really important is because Medicaid's a federal and state partnership. The federal government sticks in about 60 to 70% of the overall budget, and then the state is responsible for about 30 to 40%. And I say about because that number changes for the regular Medicaid program or current existing Medicaid program. It changes depending on poverty levels throughout the different states and how the states are doing. But what this shows us when we talk about Medicaid, what this chart points out is that, in terms of state general revenue dollars, what you typically think of as your income tax, your sales tax, a very small portion of that goes to Medicaid because we leverage a significant amount of other funds in the state that are earmarked for health care. So we end up with about 17% of the total Medicaid budget being general revenue. It's a much smaller portion than what you would think when you hear about those match rates. And that's really important when we get into talking about Medicaid expansion, because expansion is a 90-10 match rate, meaning the federal government pays 90%, we pay 10%. But that 10% is never completely general revenue. It's never 10% general revenue in the state. It would be closer to about 6% general revenue. And the other portion of the state funding would be earmarked. It's also important to recognize on the next slide how the funding is distributed. We have about 900,000 Missourians who are accessing health care coverage through Medicaid right now. The vast majority of those are kids and pregnant women. Kids make up 63% of the Medicaid population, but they're incredibly cheap to cover. So you can see this chart shows you where the actual costs are. The costs, about 63% of the total costs fall to cover people with disabilities and seniors in Missouri. So, that shows us what you would typically expect, right, with healthcare costs, is that the folks who have the most difficult conditions are the ones who are most expensive. So when we talk about Medicaid and we talk about changes to Medicaid, anytime there's a reduction proposed, the cost savings coming from those reductions would have to be coming from people with disabilities and seniors, or kids. So the next slide shows a little bit more about Medicaid expansion and what it would mean in terms of the Missouri budget. So I mentioned already the cost balance of Medicaid being a state and federal partnership. With Medicaid expansion being a 90-10 match, I already said, we really, for general revenue, only 6% of the total cost would come from general revenue. And there is a cost to that. What we understand from what's happened in other states and what would happen in Missouri from projections in Missouri, that cost is actually reduced to nothing because of the savings that we would achieve. We have existing categories of services. People with disabilities is one example. Pregnant women is another example. Services for mental health needs that are largely funded by state general revenue and have much less funding supported by the federal government. Under expansion, as people start enrolling in the expanded Medicaid category, they would be covered under the 90-10 match rather than the 60-40. That's how the state saves money. And we end up with savings, again, that totally overwhelm the actual cost. We expect that within the first years, we'll see at least $50 million in general revenue savings specifically. We also end up with increased revenue for the state, and that is not using a multiplier or any other calculation. It's just pure revenue based on federal funds coming to the state that currently don't come to the state, and that money flows into our economy, right? It comes in and helps support our rural hospitals and access for healthcare for all Missourians. It helps us fund vital services for Missourians who are most in need. We've seen, as you know, a significant portion of Missourians who've ended up facing unemployment given the COVID crisis, and this would help ensure that those Missourians have access to healthcare when they lose their jobs. So what's happened in other states is probably the best evidence of what we can expect in Missouri. And just a few examples of that. Louisiana, under expansion, saved the state, actually reduced state costs by $199 million. Michigan, Montana, Virginia, Louisiana, Colorado all had similar effects. Virginia's budget saw about $420 million in state savings, so reduced costs overall as a result of Medicaid. Same thing on Montana. And states are also seeing the increased revenue for the state as we expect for Missouri. Louisiana found that with Medicaid expansion, they had about $75 million additional funds in local tax receipts and $100 million in state funding. Michigan received about $145 million per year in new state revenue, and Colorado received about 150 million each year in new state revenue. What that tells us is expansion would free up existing resources for other services, things like education, things like public safety and transportation would all be able to be funded more adequately if we have expansion. So it's kind of a win-win for all of our services. And rather than continue to rattle off numbers, I'm going to move it over to Sidney to talk about the real kind of human impact of expansion for us.
Well, and I think I want to pick up where you left off, Amy, because I think there's lots of pieces of the human impact. And I think where you are right now is when we talk about increasing revenue. What we sometimes forget is Medicaid expansion means people who don't have insurance now. Hardworking Missourians earning up to about $18,000 a year, who work in a grocery store or a restaurant or construction, or a nurse's aide or a nurse, home health care worker, get health insurance and are able to go to the doctor. And when they go to the doctor, that Medicaid card means that the doctor and the nurse get paid. And that doctor and that nurse are able to hire a bookkeeper to help out, and somebody to clean, and somebody's going to launder the scrubs they wear. And that's what creates the revenue. So it's good for people. It's really good for people. We have over 400 studies from all those states you listed that said when people get Medicaid, they go to the doctor, they get healthier, they actually have less depression because of the mental health effects of worrying about not having health insurance, and it's darn good for the economy too.
Yep, absolutely. Absolutely, we agree. And all of the studies, as you said, are showing that, right? All of the studies across the nation in states where they've implemented Medicaid expansion long before Missouri, and they're receiving those benefits. And this is something that we want for our state too.
Absolutely. And I think, Amy, I'm really glad you pointed it out, because making it really clear to folks of how this is actually a net win for everything. It's often pitched to us as like, you have to choose. Do you want to spend more money on expansion, or do you want to do like healthcare for education or transportation? So like understanding that this is all ships rising together kind of situation, I think is a really important part. So we've talked about the 90-10 match a little bit. Do we have a graph on that? Am I losing my mind?
We do not have a graph that shows that. We have the graph that shows the net totals. Okay. So the third chart on the PowerPoint has the cost for general revenue and the savings for general revenue. Yes. And these, I would like to mention, these grow over time. The actual savings for the state grow as you move out in years. And that's because, we project that healthcare costs are going to increase for everybody, right? Over time, they're going to keep rising. Mm-hmm. What we found is that expansion actually helps keep those costs down for the state, even in the out years. So without expansion, it's anticipated that 10 years from now, we would be looking at $1 billion more in state costs instead of the savings. So under expansion, we're seeing real savings.
And that's a savings of $1 billion over and through 2026, right?
Exactly. Yep.
Yep. And we have one clarifying question. It was missed when you said it earlier. What is the percentage of the state budget right now that's going to Medicaid, Amy?
So the percentage of the overall budget versus state general revenue is different because, of course, there is federal funding coming to the state for Medicaid. So if you looked at total overall, the state budget that includes federal funds, it would be about 30% that goes to health care services through Medicaid. But if you look at just general revenue, just the general revenue costs, it's only about 16% of the total.
Thank you. And before we go kind of too far down the rabbit hole of talking about expansion, I kind of want to back up and give the floor to Sidney to walk us through what we mean by that. So like, what are people going to see when they're asked to vote on expansion? Why was it written that way? So that sort of stuff.
Okay, and I think we have a slide. And this is actually a sample ballot. That gray stuff you see in the corner said sample ballot on it. And that's the language you will see when you go to vote on August 4, except it's not up there anymore. And it's on the ballot because hundreds of thousands of Missourians signed a ballot petition to get it on the August 4th election. And it's a constitutional amendment. And it says, do you want to amend the Missouri Constitution to adopt a Medicaid expansion for persons 19 to 64 years old with an income level at or below 133% of the federal poverty level as set forth in the Affordable Care Act? That is language that says we will expand Medicaid to cover people, single people earning up to just about $18,000 a year. For a family of 3, it's about $30,000 a year. It varies based upon the family size. And that's what's provided for in the Affordable Care Act. And the Affordable Care Act states if they take this expansion, qualify for that very generous 90% federal share. And that's why the expansion is worded that way, to make sure that we get that enhanced match. The second bullet point says that there will be a prohibition on placing greater or additional burdens on eligibility or enrollment standards, methodologies, or practices on persons covered under Medicaid expansion than any other population eligible for Medicaid. When we talk about other populations eligible for Medicaid, those are the children, the people with disabilities, the seniors, the pregnant women that Amy talked about earlier. And the second bullet point is simply not just a reminder, but a requirement that these newly eligible adults be treated the same as other people, that there cannot be barriers put in their way, extra hoops for them to jump through. They don't have to run around the block 3 times to get Medicaid. And finally, it requires the state, this is a third bullet point, state agencies to take all actions necessary to maximize federal financial participation in funding medical assistance under the Medicaid expansion. We always want to do that. Do it in a way that gets us the biggest bang for our buck. And so those bullet points really spell out what we'll be voting on.
And I really want to kind of circle in on this third one a little bit. So when we talk about like what are the potential changes that could have had, I'm sorry, no, I'm clicking the wrong button.
We want to talk about those additional burdens.
The additional burdens, yes. My second bullet point.
Well, there's one thing, there's a couple of things in particular we were concerned about. A number of states have tried to impose work requirements on Medicaid people. Most adults on Medicaid, over 80%, already work. Those who don't are typically caring for a child, caring for a disabled parent, caring for a sick loved person. They have a disability. They're unable to work for a short time. They've been laid off. So when we expand Medicaid, we're expanding it for working people. The problem is work requirements mean that people have to file a form every month showing that they work. And very often those forms get lost in the mail. They get lost in the office. They get filled out wrong. And we've seen dramatic losses in coverage in the only state that's actually implemented a work requirement, Arkansas, where 25% of the people subject to the work reporting requirement lost their Medicaid in the first round. And those were people who were actually working. So we were very concerned that we wanted to discourage policymakers from trying to create barriers to enrollment.
Yeah, and we were just adding to what Sidney said, also concerned about the cost of that, right? There was all sorts of new bureaucracy that would have been needed to be able to track these work reporting requirements and receive the documentation for those requirements. We estimated that it would have cost the state at least $200 million each year just to implement that because of the ancillary supports that would have had to have been provided. So it didn't make sense from a health coverage perspective or from a fiscal perspective.
Yeah, I think it helps reinforce the idea that the purpose of a Medicaid expansion is to get people health coverage. Get them enrolled in healthcare so they can get to the doctor. And one thing we know from experience in other states is Medicaid expansion helps people work. Yes. It helps people work because it helps them control their diabetes or control their hypertension to be well enough to go to work.
Right. And something that's important, I think, is that we often forget in Missouri how low eligibility is, right? Currently, if you're accessing Medicaid currently as a parent, you know, you have to be making about $385 per month for a family of 3. If you make more than that,
to our audience, that's less than
$385 a month. You have to be in really very deep poverty to be able to qualify. So, you know, folks who are working in those low wage jobs that you mentioned before, Sidney, you know, who are doing what they can for their families and trying to make ends meet are going to struggle to access health insurance without Medicaid.
Yeah, the problem we have now is people who work even part-time jobs make too much to qualify for Medicaid, and they don't make enough to go out and buy insurance. And many of these jobs in restaurants and retail don't offer health insurance coverage. So you really are stuck, and we call it a gap, and it is a gap, and we just want to fill in that gap.
Yeah, absolutely.
Yeah, I mean, and I think the other thing that is always really powerful to me is, like, even when we expand it, we're still talking about, I mean, $18,000 a year is not, you know, living in the lap of luxury here. So like, we are opening it to people who absolutely need it. But the idea that we would open it to people who, you know, could be accessing the insurance, like you said, elsewhere, like there really aren't other options out there right now.
Yeah, no, and let's be clear, we're also talking about opening up eligibility to lots and lots of folks who have lost their jobs in the last few months. Yes. People who work in restaurants that closed down, retail stores that had to close down, construction that ground to a halt. Medicaid is supposed to be there to catch people. Ours doesn't catch those people right now because unless you're a parent, taking care of children, or you're disabled, if you're between 18 and 64, you can't qualify for Medicaid.
Right.
Yes. So there've been a couple of questions I want to touch on. We had one question that was just about, you know, what is stopping us from expanding? Why haven't we done it yet? It has been a conversation that we have been having enthusiastically for years, some years louder than others. I think, you know, feel free to chime in as well, but, you know, there is no organized opposition. There is an issue of political will stopping it here, which is why advocates have taken it to the ballot, and we want to let the people decide, because we know that there is overwhelming support among Missourians who see the need for expansion of Medicaid. But
we've always known that there's been overwhelming support for Medicaid. And what happened was in November 2018, 3 other states used ballot initiatives to expand Medicaid: Utah, Idaho, Nebraska. And in those states, the voters overwhelmingly supported it, and they have implemented Medicaid expansion. So this created an opportunity for us to try the same avenue.
Absolutely. So I wanted to touch on, we've talked a little bit about what other states are seeing in the costs, Amy. Sidney, did you want to comment at all what we're seeing as far as the health outcomes in these other states that have expanded, who've had a couple of years of expansion under their belts?
Yeah, there's been a lot, I'm in a university, and university researchers have had a great time researching the effects of Medicaid expansion because it's a natural experiment. We can compare Missouri that hasn't expanded to Arkansas that has, and we've learned lots of interesting information, and I counted up the studies yesterday. We now have 404. And they uniformly hold that it, as I said earlier, improves access to care. We see more people going to the doctor, not only getting treatment for chronic conditions, but getting those important preventive care checkups, particularly for women who need them. We're far enough into this. We also are seeing improvements in health outcomes. Researchers at Harvard estimate that Medicaid expansion has saved 19,000 lives by people being able to get chronic disease under control. We're seeing earlier cancer treatment. We're seeing less depression, as I mentioned earlier. There's also been interesting studies about the financial impact of Medicaid expansion. Fewer people struggling with medical bills, people reporting lower medical debt. Really interesting study about 20% fewer evictions in states that have expanded Medicaid. And I think that's the point you made earlier, Dina. We're not talking about people who are making a lot of money here. When you're making $18,000 a year, every dollar counts. And with Medicaid expansion, people will have dollars to spend on mortgages and rent and to get gas in the car and not have to worry about paying for the doctor. We're also seeing that it reduces uncompensated care for hospitals. Right now in Missouri, we're seeing a lot of people, or we were seeing a lot of people showing up at the emergency room needing care who didn't have insurance. That's what we call uncompensated care, when the hospital provides care and people can't pay for it. In states that have expanded Medicaid, hospitals report a 55% drop in their uncompensated care. That's more than half. And that's really important for our rural hospitals. They're fragile. We've lost 9 rural hospitals during the time that other states have expanded Medicaid and have strengthened the financial position of their rural hospitals. So it really helps keep that healthcare delivery system in place.
Sidney, you just brilliantly answered. I don't think you even saw the question come in about the impact on healthcare infrastructure in rural areas in places that have expanded. So, I mean, that's really true. And the other thing I would add on that note is, we have seen not only these other states who have benefited, but Missouri has actually taken a hit on these. So when Arkansas expanded and Missouri did not, and we lost some of those hospitals, we actually saw a flight of our medical professionals, doctors and nurses, going to work in those hospital systems that some crossed the line into Missouri from Arkansas. But when those jobs disappeared, we saw, a brain drain in Missouri of our healthcare providers that had been servicing some of those rural areas, which has, the ripple impact on, you lose that hospital and not only the jobs, but, the tax base, and that impacts the schools, that impacts all of the ripple effect out into all these communities. And I know rural hospitals are a big concern on people's minds, especially these days with healthcare being front of mind and all these different capacities. I mean, I know we're coming up here on 30 minutes. I wanted to kind of give you a space if you had any other burning questions from viewers. I have one that I was going to throw at Sidney just because I know we get it all the time. Why are we doing a constitutional amendment and not a statutory amendment?
We're doing a constitutional amendment to make sure that the voters' voices are heard. You can use a ballot initiative to either create a new statute or create a constitutional amendment. But if you create a statute, then the legislature can come back and change it. And we have seen ballot initiatives passed in this state where the very next session, the legislature revokes it. So ballot amendment number 2 is meant to carry a very strong and clear message that can't be overturned.
Beautifully said. Do you have any closing thoughts that have come to you, Amy or Sidney? I appreciate you both so much. This has been wonderful and extremely informative. It's rare that you get somebody who's like engaging to talk to and can get so in the weeds on such wonky topics. So it is a wonderful treat.
The only thing that I would say is that it's really important for everybody to tell their neighbors, go vote on August 4th, yes on 2, because, it's coming at us faster than we expected. We thought it would be on the November ballot. So August is really critical for folks to remember. But we're talking 230,000 Missourians who are currently uninsured, who could have health insurance. It brings money in from the federal government, bring our tax dollars back home to Missouri to help support the infrastructure, the healthcare infrastructure that we all depend on. It's good for our economy because of that, and good for our health, and it saves the state money, which ends up helping education as well and other services. So it's kind of like a win-win-win everywhere. I think just to end on that would be that's my biggest takeaway. It's helpful.
Absolutely.
I think I would remind people that this COVID pandemic has reminded us of the importance of healthcare and the importance of access to healthcare and the need for coverage. And I want to remind people that you don't necessarily have to go vote on August 4th. It's now easier to get an absentee ballot if you're at home and need to take care of yourself. If you're over 65, all you have to do is ask for an absentee ballot, and there are lots of other reasons that you can vote absentee. So vote early, vote early. Don't vote often, just once.
And absentee voting is open now. It opened on Tuesday of this week on the 23rd. So you can request your absentee ballots from your county clerk. And we absolutely encourage you to do that, but make sure that you're voting yes on 2 for the August 4th election, whenever you may happen to do that. But again, thank you very much, everybody, for tuning in, and to Sidney and Amy for being such wonderful experts today. Thanks, everybody.
Thank you.
Thank you.